خب من سلام میکنم. ما پارت دوم رو شروع کردیم. سوالاتون رو بی زحمت خیلی، یعنی واسه من سوال نفر قبلی رو بپرسم بعد بفرستید که سوالا خیلی بالا نره. چه محدودیت ورزشی برای نوازندگان هست؟ اوکی، من این رو میپرسم. بذارید من سوالا رو یادداشت بکنم تا موقع کادی به ما اضافه میشه. Hello Cody, I'm waiting for more audience, then I will send you the request. اوکی. آقای عرفان، من این سوالتون رو نوشتم میپرسم از کادی و یه مقدار صبر بکنیم تعداد نفرات بیشتر بشه. یاسمن جان من سوالا دارم مینویسم ولی اگر چیزی رو جا موندم یادآوری کن به. خب من کادی رو اضافه میکنم. یه سوال پرسیدن اونو میپرسیم و بعد از اون دیگه کم کم میریم جلو. سوالاتون رو بی زحمت دونه دونه بپرسید که چیزی جا نمونه از سوال ها. خب من کادی رو بهش درخواست بدم اضافه بشه. فقط به من بگید که کیفیت اینترنت خوب هست، مشکلی با کیفیت اینترنت نیست. یاسمن جان کیفیت اینترنت همه چی خوب هست؟ Cody, I'm sending you the request. Please accept it and join us. من یه نکته بگم در انتهای این لایف من یه چکیده کلی از صحبت‌های کادی رو کلا براتون ترجمه میکنم روی مطالب مختلف. سعی میکنم همه رو بهتون بگم. یعنی یه چکیده دسته‌بندی در آخرش به فارسی خواهیم داشت. لطفاً با اون باشید. اون آخرش فکر کنم برای همه اون جذاب باشه. من یه مقدار با اینکه کادی رو اضافه کنم مشکل دارم. بذارید من ببینم که خب استاد بابایی سلام، شبتون بخیر، مرسی که بهمون اضافه شدید استاد. Hello again.
Hello again.
Okay. The first question was that is there any limitation for musician about the sports that they are allowed to do? For example, are they allowed to do something like let's say bodybuilding or swimming, or what's the best actually exercise for musicians?
So the best exercise to do is the one that you enjoy. So if we think about it in two ways. So from a general movement and exercise, take care of the general health of your body. So not like a specific injury prevention program or a specific prehab program, if you want to call it that, but just the general move your body enough to keep it overall healthy. It really depends on what you enjoy. And within each activity, there's going to be some inherent like risks and benefits for a musician. If you're interested in playing something like, soccer or basketball or something like that, there are some, injury risks. If you're interested in snowboarding, there's a really high injury risk for fracturing your wrist. Snowboarding, skateboarding, things like that. So you want to take that into account and decide for you as an individual, is the risk of that injury acceptable? Do you get enough out of that? The same goes for, something like bodybuilding, where I think with any sport, like if you're going to do any activity, you want to weigh out, how does this compare to my endeavors as a musician? And can you keep being the musician? If you're the heart and soul of what you're going after is to be a musician, making sure that you have something that keeps you healthy but doesn't compete for time or doesn't take away from your musicianship. So if you're spending a lot of time, time and energy working on bodybuilding, and it's leaving your body, you have to work really hard to be a serious bodybuilder, and it's leaving your body depleted, and you're finding that you're getting fatigued earlier. You have to reassess like what are actually your goals. If you're interested in participating in a contact sport, you have to decide, is that really going to build things up for you as a musician or not? And that's going to be different for each person. In general, things that are going to load up hands and wrists and load up your upper body are things that you might want to be a little bit careful of. So I think swimming's typically fine. Swimmers tend to have just as many problems with the strength and endurance of their shoulder blade muscles as musicians. So it's some people think that because it's an upper body dominant activity that they're getting all that they need there, but swimmers notoriously have issues in their shoulder blade muscles. So that doesn't mean that you've kind of checked that box and you don't have to, it's not that that's automatically taken care of. But overall, it's a matter of what are you going to do consistently and what's going to bring some joy to your life? Because it shouldn't, from a exercise standpoint, like I'm not a huge fan of go stand on the treadmill and be bored for 30 minutes kind of a thing. I think it's better to go, get yourself outside, get yourself with friends, do something interesting and move your body that way. But so I can't make decisions for individuals. I can provide recommendations and I can give people a little bit of a broader view of what's higher risk, what's lower risk, and how important is it to you. But I don't have something that's a yes this, no you should never do that. Because every time you say no you should never do that, you can point at somebody who's performing at a high level who's doing exactly that.
Mm-hmm. I think, thank you for your answer. Thank you for the complete answer. I think the thing is that the audience would like to know, for example, if he does bodybuilding, does it contradict playing his instrument? Because, when we play the instrument, we are really delicate. We use a small muscles, they move slowly, they move actually, let's say, they are not big muscles and do not compare that, actually do not use that much energy. But if you do, for example, bodybuilding and try to make them big and bigger, do they help a musical injury or it contradicts?
It depends 100% on the approach. So I've seen people who are bodybuilders who are massively strong in their bigger muscles and tragically weak in their smaller muscles. And so that's going to have no benefit to musicians really, to be really strong in your biceps and in your lats and in your smaller middle back muscles and stability muscles that you're still having a hard time. It's not going to help. I don't think, and there's better ways to train things and worse ways to train things as well. So there are some bodybuilding protocols that I think that are really complete and that would make you stronger in those postural muscles and keep you flexible and mobile, and might benefit your playing. There's other protocols that really don't do any of that, so you'd end up very big, but not be able to perform very well. So it gets really hard. It gets really hard because there are so many. It's a matter of how well one does that endeavor. So I think bodybuilding could be done if, I guess the hard thing with bodybuilding, if you're serious about bodybuilding, that's a whole lot of time. And if you're serious about music, that's a whole lot of time. And so it can be the saying that I like frequently is, he who chases two rabbits catches none. You pursue two competing endeavors and you'll be, depends on where you want to be. If you're happy being a good but not absolutely wildly great musician and you enjoy bodybuilding, and then that's perfect. But it can be. I frequent one thing, and again I'm waffling a little bit because one thing that I tend to do in my interactions with people is I try and tease out what are their actual goals, and then look at how their behaviors are feeding into, bringing them towards or bringing them away their stated goals. So if this individual came into me and said, I've got this, I want to be really world-class guitar player. I'm having all of this left shoulder and wrist pain, and I'm doing a lot of bodybuilding, and I'm spending 4 hours a day with independent practice and 2 hours a day in rehearsals, and I'm spending 2 or 3 hours a day doing bodybuilding type things. It's like water.
Yes.
And I've heard hours like that from people. I've heard insane hours like that. And so that's one of those, like, you can't, like, your body is not going to accept that. We probably want to reduce the playing volume, and we probably want to reduce the exercise volume. But even if it's a more manageable playing volume, and then you add in the exercise volume on top of that, that's still water. Exercise is interesting. You grow your body by dumping water in the cup in a strategic way so that it gradually gets bigger and bigger and bigger. But if that's layered on top of your music and it's causing a problem with what you're doing, then it's bringing you in the wrong direction. It's bringing you in the wrong direction.
I think that the guy was committing suicide.
Sometimes I think many musicians are slowly doing that.
Yes,
especially musicians in university, man. I hear 8 and 10 hours of time on instrument.
Yes. And when they face RSI, repetitive strain injuries, they say, why did it happen? Why did it happen? And they say, okay, you were practicing about 10 hours a day. That's the reason it happened. Okay,
so for both, for music and for bodybuilding, you can be more or less efficient in both. So it might demand, if you want to do both of those, you might have to try and be very efficient in your time for both. Both are areas notorious for throwing volume at a problem, like just volume of practice time in an unstructured way, or volume of sets and reps in an unstructured way. There's lots of people doing bodybuilding who are doing far more sets and reps than are scientifically proven to adapt your tissue, and you get bigger slower. So
yes, I know about that. Thank you for the demonstration. Let me just translate this one and go to the next question. نکته خیلی جالبی که کادی گفتش که ورزش کردن خیلی بستگی داره که در وهله اول می‌خواید خب سلامت باشید دیگه. بحث عمومیشو اگه نکنیم ما همه ورزش می‌کنیم که سلامت باشیم و برای هممون هم ضروری هست. و اینکه قاعدتا اون ورزش که شما ازش خیلی لذت میبرید بهترین ورزش برای شماست و ببینید که کدوم خیلی حالتون رو خوب میکنه. ولی در هر صورت ورزشایی هستن که احتمال آسیب دیدگی توشون بیشتره. اون ورزشا رو باید یه خورده ازشون جلوگیری کنیم، به سمتشون نریم. مثلا چه میدونم اگه اسکیت بازی میکنم ممکنه بیفتم من دستم بشکنه، یه چیز خیلی واضحیه. و اینکه اینا میتونن یه خورده آسیب زننده باشن. بعد اینکه نکته دیگه که هست اینه که ما زمانی که ورزش میکنیم یه انرژی خیلی زیادی از ماهیچه میگیریم. خب بعد میخوایم تمرینم بکنیم، ماهیچه خب به طب تخلیه شده از ذره انرژی، یعنی دیگه اون ذخایر انرژی از بین رفته. حالا ما میخوایم شروع کنیم تمرین کردن، اون موقع دیگه ماهیچه رو داریم الکی زور میزنیم دیگه، فقط آسیبه، بهش کاری نمیاد. و اینکه خب هدفتون رو تعیین کنید و اینکه فکر نکنید که من گیتاریستم میخوام قهرمان بادی بیلدینگ هم بشم، این شدنی نیست. باید شما به عنوان یک نوازنده خب تایمت رو برای نوازندگی بزنید، روی اون حساب بکنید و روی اون کار بکنید. حالا که نشه ورزش داشته باشید، ورزشی که معقول باشه، فشار زیاد نداشته باشه و در همجهت با نوازندگیتون باشه تا حدودی. مثلا من برم بادی بیلدینگ وزن خیلی سنگین با حالت اشتباه بلند کنم، قاعدتا این همجهت با نوازندگی من نیست، چون من دارم قدرت رو توی جهت دیگه تقویت میکنم. منطقاً ورزشی که همسو باشه بهتر کمک میکنه. خب یه سوال دیگه راجع به تنیس البو هست، من میپرسم. Okay, Cody, someone asked about the tennis elbow. I know this guy. He has faced the tennis elbow injury in her left hand. He is a guitarist. He is righty, but he has faced the tennis elbow in her left hand, and he wants to know what should he do.
So tennis elbow is one of these where I'll frequently start further up the chain, and so I would, and there's a couple of really nice exercise protocols out there that have been proven to be effective for tennis elbow, and it's a basic shoulder blade strengthening, rotator cuff strengthening protocol is where you start with it. So if there's loads of resources for shoulder blade and rotator cuff strengthening, and then thoracic mobility. Those three things can feed into how well your forearm muscles work. So the way that I tend to describe, the shoulder's the relationship to the wrist and the hand, is that your shoulder and your shoulder blade are going to create a stable base for your hand for the muscles of your hand to function off of. If that base isn't great, your hand can still function, it just has to work harder. It's like the difference between running on a track versus running on the beach. You can run on the unstable surface of the sand. You get tired faster and you go slower. So from a tennis elbow standpoint, making sure that you are good here, you have a good stable base here for your forearm muscles to function off of is a good place to start. Because if you can reduce the amount that those forearm muscles need to work, by having that stable base, that sets the table for you. The second piece is that tennis elbow is a tricky tendon problem. So if it's been around for a while, it would no longer be classified as a tendinitis. So a tendinitis means that there is a problem with inflammation in the area. And what's been found for tennis elbow is that at those tendon insertion points, there's not an inflammatory problem anymore. There's not chemicals that are associated with inflammation. It's a healing process in that area that's gone awry. And so you have, to make a really complex topic simple, your tendon is unhealthy. And so if you do things like give anti-inflammatory injections or take anti-inflammatories, those are good for inflammation, but those are bad for your tendon. So in tennis elbow, you'll see some research showing that if you have the injection, you do great at 6 weeks, but at a year, your outcomes are worse. So what you really need is to figure out ways to use exercise as a progressive loading strategy to change the structure of your tendons. So this is something that people don't think about with exercise. Is we tend to think of, if I exercise, I make my muscles stronger or more coordinated. But when you exercise, you also improve the strength and resilience of your tendons, your joints, your ligaments, your discs, all of these other structures. The problem is that those change at a much slower rate than your muscles. Your nervous system will make you better at a movement within a couple minutes to a couple of days. Your muscles will get stronger within a couple of weeks. Your joints, your ligaments, your tendons, all of these other structures take months to change their structure. So with tennis elbow, you're looking to change the structure of that tendon in a positive way, which means looking at your exercise in a long view. So what tends to get recommended is a kind of a typical, wrist flexion extension with a weight. So you got a weight. I'll use my water bottle. A lift up, pause, lower down. There's been some research out there looking at eccentric exercises. So doing just the lowering component of it, you lift it up, lower down. There's one with a therabar. But what's been found is that doing eccentrics only versus doing the up and down, the full range of movement, you actually do a little bit better with the full range of movement. What I'd recommend that you do is you get your metronome out, you set it to 60, you do about 2 seconds up and 4 seconds down. So really emphasizing that down, up, very slowly down. You start with a load so that's number one, is you need to have a way to load that tendon. Number two, you need to load that tendon appropriately. So that means starting at a level where you provoke a little bit of discomfort as you exercise, but that calms down back to its normal level within an hour or two. So if you exercise and it hurts more for a day, then you're overloading that tendon. That's more than it can handle, and you're going to make things worse. So this tendon problems are tricky because with exercise, if you exercise, there's kind of too little. If you do less than that, you get weaker. If you do more than that, you hurt yourself. So you have this window of exercise that's therapeutic. For tendon problems, that window tends to look like this. So you need to experiment a little bit. And if it's been around for a long time and you haven't seen a good healthcare practitioner who can guide you through that can be helpful. One thing that I spend a lot of time with people on is, where are you right now? What is the load that you can handle right now? Because if we overshoot, we're going to make it worse. But if you can start that level of exercise and very gradually increase that, it's going to be a 12 to 16 week program that you're going to want to stick with it, minimum 4 months to change I would probably recommend doing that program for in the 6 month range. And it seems like a crazy long time for people starting off, but in that time frame, you will make a big change to the physical health of your tendon, and you'll start to find that, kind of weeks down the road, you're able to do more load with less discomfort, and then you'll start finding that it just feels like you're exercising, not like it hurts. But tendon problems like that are difficult because you have to have a long game approach to the exercise strategy and the treatment of it, and it's hard in the middle of it.
Okay, I have 2 questions about your answer. First of all, thank you for the demonstration. The first one was you mentioned some shoulder exercises. Do the audience can find them on your YouTube channel, on your Instagram page?
Yep. They won't. They might be on my. I can't remember if I put them on my Instagram page. Let me look on my. They should be on my YouTube channel. I can give the names now.
Uh-huh.
So if you want, secret tip for the people listening is that so when I've got on my website, like many people do, the sign up form, and you get the you can get like a free injury prevention program. They're all on the YouTube channel, including a 15-minute starting exercise program
Uh-huh.
that goes through all of the areas.
Okay, I will ask you, is it possible, of course you can say no, but it is possible to just post those exercises, maybe one or two of them on your Instagram page, or just forward it to me? I can post it to let the audience know
Sure.
more about the exercises.
Yeah, so here I will post again. Oops, I'm pushing buttons I shouldn't be. I will post the thoracic rotation with your hand behind your head. That's your middle back exercise. I'll post a sideline external rotation with a small weight, and that's your rotator cuff exercise. I will post shoulder blade squeezes lying on your stomach. That's a shoulder blade exercise for the backs of your shoulder blades. I will post where did my scapular wall slide, which is a muscle on the other side of your shoulder blade. And I also have on here that I don't think I've posted an exercise so one of the things with tennis elbow is that you find that so you have a couple of different muscles on the back of your wrist. So you have the muscles in general that attach to your wrist and come down here, but also attaching to the same place is the muscles that go all the way down to the backs of your fingers. So you find people are using a lot of these, you can see the tendons poking out, their finger extending muscles more than they need to. And so there's an exercise where you put your hand flat on a surface that's kind of similar to some of the things that I saw on your website, but it's just can you do, keep your fingers straight, so your fingers are going this direction, but your wrist is going back. So it's trying to get wrist extension being pulling your wrist this way, which is the muscle group that tends to be injured in tennis elbow. You're getting wrist extension while you're getting finger flexion, so you can't overuse those finger muscles. So that exercise also appeared in a study for improving tennis elbow. And that's on my YouTube channel as well. I'll post that too.
Thank you. And one question, is the person who has faced the tennis elbow injury allowed to play his instrument while he's trying to actually treat his hand or his injury?
So like all of my answers, I have annoying answers that all are like, it depends. So the same rules for playing, I use the same rules for playing as I do for exercise. Does your playing are you able to recover from your playing? So if you play and it ramps up your pain and it doesn't come back down relatively quickly, then you need to find the right amount of playing that your body can tolerate right now. There's a load of other things that you can do aside from time on your instrument that would be really productive for your playing. So I think people probably, especially when they're injured, can take advantage of a whole host of different things such as mental imagery. There's a group that I work for that's done some work on really bad chronic hand problems, and they've found that even in people who have so it's called chronic regional pain syndrome, just a really terrible pain condition, but it's so bad that they can't differentiate right and left hand. So there's some apps out there that can do basically it's a brain training program. So there are exercises in the realm of brain training that you can do. There's imagery practices, there's reviewing the score, there's all of these different things that can be taken advantage of when you're not physically playing. But long story short, you need to be able to tolerate the playing. You need to have signs from your body that the playing is okay and appropriate and that you're recovering from it. With any exercise, as you do it, you break your body down, and then it should, as you recover, build itself back up a little bit stronger. If with your playing you're breaking it down and you can't recover, and breaking it down and you can't recover, and breaking it down and you can't recover, doesn't matter if you're healthy or injured, you're going to go in the wrong direction.
Okay. Thank you for your thorough answer. Let me just translate it for the audience. Thank you. کادی یه خیلی طولانی شد. من سعی می‌کنم خیلی خلاصه بگم دیگه این مطلب رو. در رابطه با تنیس البو گفتش که اول باید ببینیم ریشه‌اش کجاست. معمولا ریشه تنیس البو میاد داخل گردن، به خاطر اینکه اعصاب درگیر شدن و اینا میاد داخل گردن و شونه و مثل میمونه که من ماهیچه‌های وقتی ماهیچه اینجا دارم استفاده می‌کنم، مثالی که زد جالب بود. گفت مثلا اینکه دارید رو آسفالت میدوید، مثلا روی جای خیلی اوکی دارید، روی جای خاکی که مثلا خیلی صافه دارید میدوید، یا اینکه دارید تو شن میدوید. وقتی از بالا درگیره انگار شما دارید تو شن میدوید. و ماهیچه‌ها دارن زودتر خسته میشن، بیشتر داره بهشون فشار میاد. یه سری تمرین‌ها گفت که توی کانال یوتیوب خودش هست، من ازش درخواست کردم که برامون پستش کنه. میتونید اون تمرین‌ها ببینید که برای قسمتشون هست. و بعد یه سری تمرین‌ها هم داد برای قسمت در واقع ماهیچه‌های روی ساحل که حالا خودش کامل نشون داد. من مجددا نشون نمیدم که خودش کامل نشون داد. میتونید اون تمرینات هم استفاده کنید. گفت من معمولا بچه‌ها میگم که اون مترونوم انجامش بدن، روی 60 در واقع تنظیم کنن اگه اشتباه نکنم، چون خیلی گذشت از صحبتش ممکن من اشتباه بگم. گفتش که معمولا فکر می‌کنم 2 شماره بالا یا 4 شماره پایین، یا برعکسش 4 شماره بالا یا 2 شماره پایین. حالا برید عقب‌تر توی لایو هست. بعد اون تمرین‌ها رو هم گفت میتونید انجام بدید و اینکه در طولش میتونید ساز بزنید. یعنی گفت اگر درد دارید نه قاعدتاً باید چک کنید، اگر که داره درد میگیره و اون درد رو اذیتتون میکنه نباید ساز بزنید به اون مدت. و گفت فرآیندش بین 12 هفته تا 16 هفته اگر اشتباه نکنم، ولی گفت به طور معمول تا اینکه کامل از بین بره 6 ماه زمان لازم دارید. فرآیند خیلی آسونی نیست و نیاز به استراحت هم داره ماهیچه. Okay. No, a repetitive question. Musicians usually when they face injury, they say, okay, fix us in a blink of an eye. Okay.
What?
What's the idea about that? You know, everybody that is a musician knows about this. You know, when they face injury, they come and say, okay, help us. Okay, fix us. They just want to be healed in a second. Let us know more about that.
Yeah. In terms of the people who just want to be fixed. Yeah, injured and just want somebody to fix them. Is that the question? Yes.
Yes. Yes.
Yeah.
Ask anybody come to you to say, fix me in a second, because it happens a lot.
Yeah. Oh yeah. Yeah. So I'm pretty upfront with people. You know, I tell people, you know, I don't have any solution, but the hard way, but it's the permanent way. You know, I can do some things that'll dampen things down. I do have ways that people associate with fixing them. You know, manipulations. People claim I'll put this back in place and you'll be just fine, or we'll put a needle here and you'll just be fine, and that saves everything. And in reality, those are like the research is really clear on this. It's just a temporary reduction in pain. I call it like my nervous system sleight of hand. You know, we can tinker around with things and make things more comfortable, but that does not solve a problem. And if you're really serious about solving a problem, I've got the hard way. It's the only way. It's the only way if you want to do it. And I make it pretty clear, like we're trying to use movement and exercise and some of these other lifestyle strategies to change the physical structure of your body, and that's not easy to do. But if drug companies had a drug that worked as consistently and as well for such a variety of conditions, that all of the side effects were positive, they'd be printing money. And that's exactly what exercise is. Like exercise and movement is more effective than any drug out there ever created, and it's free. You just need to know it's hard. You know, it's hard because there's this behavioral change, this human component to it, but it is far and away the most effective treatment for any musculoskeletal problem where something's not physical. Like if you have a big broken bone, yes, you might have to put pins and put that together. If you have a tendon that's torn away or a ligament that's been torn away, yes, you might have to have a surgeon come put things together. But especially for you know, these repetitive overuse injuries, there's nothing more effective. Like there's no medication that's more effective, and this is the approach that works. And so I've had people not want to continue with me for a time because I say this, and I'm okay with that. I'm not for everybody. But they eventually cycle back around because people will offer them false promises of I'll fix this and I'll fix that, and lay down on the table and fix me, and it doesn't work. And I'm patient enough to wait, and it doesn't hurt me anymore if people decide to take a different route. But so I spend a lot of time. I spend a lot of time as a reluctant salesman of types, where part of a skill set that I must have is I have to be able to communicate what I think clearly enough so that somebody believes and trusts me. Because if they don't believe and trust that I know what I'm talking about, there's no way they're going to go through all of this work in time and believe that, like, they have to believe that this is going to get them to where they want to go. So that's partially my job, but sometimes people need a little bit of time as well.
Yes, musicians, they don't consider that for that injury they have spent maybe 15 years, maybe 20 years, but they want to be fixed in a second, because they consider that for that bad posture, that repetitive strain, you have spent a lot of time on that and try to construct it. Now you want to just collapse it in a second and construct another one. It's impossible. It takes time, but they never consider that.
But you can reframe it really nicely and that it's been like this for 15 years. And I bet you in 12 weeks, we can make a big change in that. Like 12 weeks feels like a long time, but in relation to 15 years, it's not. You can make, if I've seen people make humongous changes in, really big problems in a 12-week time frame. And isn't that crazy that with something as simple as moving your body in a particular way, you can unravel 15 years of something? Like, that's absolutely miraculous. And it doesn't take another 15 years to get it back.
Yes, and that's the good point. But musicians do not consider that. For example, 12 weeks in relation to let's say 15 years is nothing. It's absolutely nothing. But they do not consider that, and they say, "Fix me at the moment."
Yep. But so yeah, I think being able to, I've spent a lot of time trying to figure out how to. One of the more, I guess, therapeutic or useful things is being able to help people understand what they need to know in a way that kind of meets them where they are. I think as a clinician, I need to be sure that I'm speaking in concepts and analogies rather than anatomical, strictly anatomical terms, because it's really, if I go over somebody's head, they're not going to understand the importance of something, and it's not going to get done. So I think it's important to be skillful. I've spent a lot of time trying to be skillful in the words that I use and figuring out what's helpful for people and what's not.
Sure. Thank you. Let me just translate this part as well.
Sure.
یه نکته خیلی جالبی که کادی گفتش که ما توی بحث آسیب نوازندگی باید شرایط تغییر بدیم، یعنی عادت‌های غلطمون تغییر بدیم، بیا عادت‌های جدید جاش بذاریم، فرآیند زمان. و اگر که مثلا یه کمپانی اومد گفت من با این قرصا و اینا خوب میکنم، قطعا یه درمان خیلی لحظه‌ایه و تاثیر برای موزیسینا که حرکت تکرار شونده دارن قاعدتا نخواهد داشت. و یه نکته که بود گفتش که مثلا موزیسینا، من سوالی که ازش پرسیدم این بود، من سوالو فراموش کردم بگم. موزیسینا آسیب میبینن بعد میام میگم سری ما رو خوب کن. خب این شدنی نیست. شما مثلا n سال زمان گذاشتین ساز زدین، این آسیبو دیدین، خب حداقل باید مثلا n ویک براش وقت بذارید که برگردید به حالت عادی. الان کادی هم نکتهش همینه، میگه مثلا من 15 سال ساز زده، تو 12 هفته میشه نوازنده خود به شرایط عادی برگرده، میشه 3 ماه. ولی موزیسینا 3 ماه و معمولا خیلی تحمل نمی‌کنه، همش میگن سریعتر خوب بشیم. خب این فرآیند سریعتر خوب شدن چون به ذهنمون هی داریم فشار میاریم که من باید سریع خوب شم، به طب فرآیند خوب شدنمون رو عقب میندازه دیگه. خب من یه دونه سوال راجع از کادی میپرسم در رابطه با اینکه بعد از اینکه این فرآیند فیزیوتراپی انجام میشه چه پیشنهادی به در واقع کسی که پیش میان میده، و بعد فکر نمی‌کنم یه سوال دیگه میده باشه. Okay, Cody, I have another question from one audience. They mentioned when a patient come to you, especially musicians, and they become better, they heal. And after that, what do you suggest them to do? Do you suggest them to practice any special method, approach, or exercise? What do you actually suggest them?
So I'll typically have, there are a couple of tests. So if I find an area that is an area of their body that I think requires specific attention, I will give them an idea of what the standard is for that area. So if it's their deep neck muscles, there's a test that people can do on their own, lie on their back, tuck their chin down, lift their head, and count the number of seconds they can hold it without pain. So I'll let them know, like, what's the standard on that test, and to continue practicing the exercise progression, to teach them how to progress that to the point where they can do that. Once they can reach the standard in one of these key muscle groups for musicians, I'll give them ways to self-test themselves. So if you test it every couple of weeks or every month or every 2 months, you'll notice earlier, am I going in the wrong direction? From then, they don't have to do the exercises forever. I'll recommend, go find an activity that you enjoy and engage in that more kind of complex, socially engaging activity. Take care of your body well. Find something that works for you, whether it's going to a gym or doing yoga or, doing working. There's several trainers that work specifically with musicians. Work with a trainer. Find some way that works for you to move your body regularly. Check in with yourself on these key areas. And if you're noticing that you're going backwards in a key area, start bringing back in the rehab exercises. So I think of things in tiers. So you have your general wellness for being a human, and then you have some supplemental work for areas that can be problematic for you. And I teach people how to decide, do I need to be doing this supplemental work, or am I doing well enough in that area that I can just go have fun?
Yes. Okay, thank you. Just give me some moments to translate that. نکته که کادی گفت خیلی من همش اسما رو امشب ببینم چه اشتباه میکنم. نکته که کادی گفت جالب بود. گفت معمولا ازشون تست میگیرم ببینم تو چه شرایطی ان. اگر که مثلا شرایطشون اوکی از نظر من دیگه کم کم میگم بهشون میتونید برید، ولی مثلا یوگا کار کنید و یا مثلا با کسایی کار کنید که به صورت تخصصی با موزیسینا کار میکنن. میتونید بگید مربی دیگه، ترینرایی که به صورت تخصصی مربی‌ها با موزیسینا کار میکنن و کمک میکنن که موزیسینا از اون بعد مثلا شرایط خوبی داشته باشن و بتونن خوب ساز بزنن. مثلا تمرینات زیر ساختی میدن، تمرینات خارج از ساز میدن، هی پاسچرشون رو چک میکنن و چیزای شبیه این که توی میوز ماسل هم خب این قضیه هست دیگه. یه سری ورزشاییه که به صورت ترینر مربی به شما میده و براتون برنامه مینویسه و تلاش میکنه که شما بعد از اون که حالا برگشتید به شرایط عادی بتونید با استفاده از اونها کاری بکنید که مجددا آسیب نبینید. البته خب کادی راجع به میوز ماسل صحبت نکنم، من داشتم اضافه میکنم با تجربه اطلاعات قبلیم. یا مثلا متد دیگه ای که مثل الکساندر که به شما هی نشون میده که مثلا توی شرایط عادی باشید، پاسچرتون همشون درست باشه. یا یوگا که در واقع با تمرینایی که داره باعث میشه شرایط بدن تو شرایط خیلی خوبی قرار بگیره برای ساز دادن، آرامش ذهنی و جسمی همه چی داشته باشید، خیلی خوبه. خب فکر نمی‌کنم دیگه سوالی باشه. من از کادی خداحافظی می‌کنم، بعد یه جنبندی 1-2 دقیقه‌ای از امشب پایین باشه. Okay, Cody, all the questions are answered, and thank you so much for joining us tonight.
Thank you so much. This has been a lot of fun.
Yes,
I hope it was helpful.
I had a good time, and I learned lots of practical information. Thank you.
Good, thanks. Happy to help.
Yes, and I know that it's Sunday and it's family day. I don't want to make you more tired. Have a great day. Thanks for joining.
Thank you so much. Have a good night, everybody.
Thank you.
Thank you.
خب شب همگی بخیر، خسته هم نباشین. لایو خیلی جالبی بود. اوکی، لایو خیلی جالبی بود. من خودم خیلی چیز جالبی یاد گرفتم، در رابطه با نکات مختلفی صحبت کردیم. یه نکته خیلی جالبی که گفت راجع به ارکستر استرالیا بود که گفت یه بررسی کردن دیدن که نوازنده توی ارکستر اطلاعات خیلی کمی از شرایط جسمانیشون دارن و همین مسئله داره خیلی آسیب میزنه. خیلی یه سری من این بحث رو مطرح کردم که ما میخوایم به صورت کامیونیتی کار کنیم روی این قضیه، تکنیک‌های مختلف بیان کنار هم دیگه، بتونیم تبادل اطلاعات داشته باشیم و موسیقیان تا جایی که میتونیم کمک کنیم. نکته جالبی که گفت یه سری مدرسه توی کانادا و دانشگاه کالرادو امریکا تو این قضیه پیشرو دارن کار میکنن و کادی رو در واقع دعوت کردن که روی این مسئله کار کنه، چون به نظر من واقعا از بحثی که ما موسیقی رو شروع میکنیم باید اینا هم کنارش باشه که بتونیم از این آسیبا جلوگیری کنیم. جلوگیری بهترین راهشه. راجع به تنیس البو و چیزای دیگه صحبت کرد که دیگه من پارت ترجمه کردم. نکته خیلی جالبش نکته خوابش بود. من دارم تلاش میکنم یک نفر رو برای این قضیه خواب پیدا کنم که باهاش صحبت کنیم، چون خیلی نکته جالب خودم دوست دارم بهش بدونم. اگر که شد حالا میذاریم توی صفحه دیگه. اگر سوالی داشتید به من پیام بدید. اگر از کادی سوالی داشتید که مونده بود من میتونم حالا تو اینستاگرام براش ترجمه کنم ببینم جواب اگر داد جوابشو به فارسی ترجمه کنم بهتون بگم، چون سرش خیلی شلوغه. مرسی که به اون اضافه شد دیگه، خیلی طولانیش نکنیم، 1 ساعت و 40 دقیقه شد. شب همگی بخیر. ممنون که به اون اضافه شدید. خدا نگهدار.